Hey, hi guys, Dr. Dan Nightingale here, your clinical dementia specialist. Thank you for joining me on this video today. We're going to talk about early diagnosis and treatment and why it's so important, and also something new that has just been discovered. So, I hope you're all having a great day. I hope you're all having a great week. I certainly am. The weather's beautiful. And I'm only 1 week away from going to England on vacation. Yay! And as always, I am joined with my beautiful wife, Lynn. Hi, Lynn.
Hello.
Hello.
Wait,
Yes.
You said you're enjoying the beautiful weather here, but we're going to England in a week. What's the weather like there?
Dismal. Probably raining, grey, dark, but it'll be refreshing.
Okay.
And we'll see some green.
Okay.
Don't see much green in northern Arizona, so we might see some green. Okay, guys, so why is it important to get as early a diagnosis as possible? Well, the answer to that is so that we can get the right treatment and the right therapy as soon as possible. You know, very often, and this is a widely known thing, especially with men, if men have a problem, they'll put it off and put it off and put it off until it's too late to get it fixed. Whatever that is, whether it's a mental health issue, whether it's a physiological problem, or whether it's a memory cognitive issue. So, I want the message to be spread all throughout the globe that it is so important to get an early diagnosis. So the minute somebody starts to feel a cognitive change, a change with memory, I want you to go and get help immediately. And this depends, wherever you are in the world will determine where you go to get that level of help and assistance. Okay? Normally you would start with your general practitioner, your primary physician, who will do a little test, a cognitive function test, just to see whether there is something wrong. And they'll probably do some other tests as well, some functional tests, some blood tests, some physiological tests, just to rule out anything that isn't neurologically or neurocognitively related. If there is a concern, then that person, that PCP, should be referring to the neurologist, preferably a neurologist who specialises in dementia or cognitive issues or neurological, neurocognitive disorders. When that happens, a whole battery of tests will be completed through neurology. They will do physiological tests, psychological tests, memory, cognitive function tests. And one of the things that you will have is an MRI. MRI is where you go in a scanning machine and they scan, in this case, your head. They'll do a head scan and they're looking for any abnormalities in blood flow or any shrinkage in any part of the brain, or any other abnormalities that they might detect. Now recently, this week actually, it has just been reported that scientists are now able to use an fMRI machine, a functional, which is the most common kind of MRI that people have, a functional magnetic resonance imaging scan, to predict with 80% certainty that somebody will develop Alzheimer's disease in 9 years' time. That is a prediction of 80% accuracy. Now just think about that. That is good. And what that means is that if we're detecting the fact that Alzheimer's disease will present in nine years' time, we now have an opportunity to be proactive and use a therapy, a treatment that prevents that from happening. So preventative medicine is fantastic. It's one of the best things we have. And this is the first time that we've been able to detect for so far in advance that somebody's going to present with the symptoms of Alzheimer's disease. And that is amazing, because at the same time, we're seeing the development of new treatments and new therapies. So all these things working together is fantastic. So it's a very exciting time to be working in the field of dementia right now. So my message to everybody is, if you recognize even the smallest change in your cognition or memory, and this means if, for example, you can't remember somebody's name and then it comes back to you, well, that's okay, but if it happens a couple of times, then that might be an indication that there's something wrong. Go and get it checked. Go and get it checked as soon as you realise, as soon as you recognise and notice that something is wrong. Okay. I can name a number of cases where somebody has recognised and done something about it, and where somebody has recognised and just blown it off. So get it seen to, get it evaluated, get it assessed. Never ever just blow it off. Okay. I think Lynn has something that she would like to contribute.
Yeah, because, well, I was going to say, if you notice something in yourself, or if you notice something in your loved one, right, say something, but don't be afraid to speak up, because some things are explained by stress. Some things are explained by medication side effects. Some things are explained by lack of sleep or nutrition. So don't be afraid to ask questions, is what I'm saying.
Yeah, because your primary physician will do that, will rule out any physical problems that are leading to a cognitive problem. And an example is an overactive thyroid. If somebody has hypothyroidism, they will present with dementia type symptoms. Once that hypothyroid gland is managed effectively, those symptoms go away. And that's what we call a secondary dementia. A primary dementia is Alzheimer's disease, vascular dementia, Lewy body dementia, Pick's disease, frontal temporal dementia. Those kind of things are your primary dementias. If we've got something that is related to a physiological disease, once that's addressed, then that secondary dementia, the symptoms will go away. So it's important that you do go, as Lynn said, and get all those things ruled out. The way it works in England is you will go and see your GP. Your GP will carry out a cognitive function test, and if he detects something and is able to rule out any physical issue, then he will refer you to what is known as the memory clinic. And the memory clinic is where all the professionals are based, and where they will carry out all those battery of tests and come to the conclusion of what is happening and what's going on. And if we're showing very early mild stages and signs of a dementia type illness such as Alzheimer's disease, we can get the proper treatment and therapy going straight away, and the proper resources and support in place. If you're in the US, it works a little bit different. You go to your primary care physician, they'll do what they do, carry out the physicals, and if they have any underlying concerns, they'll refer straight to a neurologist. Okay, so Lynn, absolutely right. There are many, many physical things and mental health issues that can lead to dementia type symptoms. So, good point.
And also underscore the fact that just because you're losing track of things in your mind, or names, or where you left your car keys, some things are just part of normal aging as our filing cabinets in our brain become overstuffed and you have to let go, right, of some pieces of information that there's just not enough space, and they'll be able to tell you whether it's part of, a normal part of aging, because as you say, your hippocampus shrinks 2% or 0.2% every year, right? So
yeah, 0.5%, yeah.
0.5%. So there's some normal part of aging where we are going to forget things, but they will be able to tell you that, and it is okay to forget some things, but there's a difference, right, between when you should be concerned or not. Do you think people, if they're concerned about themselves or their spouse or parent, do you think they should Google questionnaires that kind of give you like a snapshot if you think the person, if they have symptoms of forgetfulness, does that equal maybe mild cognitive impairment? Do you think that's useful for them to do that, or could be slippery slope?
Yeah, I think I like to advise people to avoid Dr. Google. If there's a concern, go and see a healthcare professional. Okay. The things you'd be concerned about, you're looking for, is people having issues with short-term memory, immediate memory, working memory. For example, what did you have for breakfast this morning? I'm not sure. I can't remember. Okay, so that would be one thing. Something that goes along with that is disorientation in time and place. I should be able to ask Lynn right now what time of day it is without her having to look at a watch or a clock, and she should be able to tell me approximately what time of day it is. If somebody has a cognitive change, a memory issue, they'll struggle to do that. And the third thing to be looking for to go with that is not being able to follow a simple routine, something you've been doing all your life, fastening your shoelaces, baking a cake, those kind of things. Those three things, if they work side by side, they're definitely things that need to be investigated further. As Lynn said, we all forget stuff. Our memory is not perfect. Our memory is fluid. We used to think it was static. We used to think memory was in one part of the brain. Now we know it's not. It's fluid. It goes all over the place. And as you sit listening to this video, watching this video today, you are listening to my voice. You're watching my body language. You are taking in the light, artificial light, natural light, any other sounds that are around you, and any other thoughts that you might be having whilst you're watching this. Your brain is absorbing so many things at any one time that occasionally it will forget something that is important. It will forget stuff that isn't important. It'll throw out of the brain the things that you don't need to remember and that are not relevant, but just every now and then it will throw out something that you really wanted to retain. If that happens occasionally, that's fine. But those three key things that I mentioned are the important things to watch for. Okay?
And that's why neuroplasticity is so important.
Right. It's why it's so important to get an early diagnosis, because where neuroplasticity is concerned, you can work with the brain and different areas of the brain to compensate and to relearn something. So you can strengthen memory. Hippocampus, Lynn mentioned the hippocampus, a lot of your memory is there. So we can strengthen the hippocampus through neuroplasticity, and brain health, other brain health exercises that go with that. And you can lay down new neuronal pathways. So if you have lost a memory, we can regain it, we can find it, we can lay it down again so it comes back. Yeah, so neuroplasticity is part of that treatment and therapy program.
And that's regardless of having been diagnosed with dementia or a mild cognitive impairment.
Right.
Even if just the fact that you're over 40, you should be doing something right.
Yes, you should.
With your neuroplasticity and taking advantage of being able.
You should exercise your brain like you exercise the rest of your body. The brain is a muscle, so the more you exercise, the stronger it becomes. And we all know now, in the world of dementia, we all know that physical exercise, and particularly weight training, is proven to help with brain health and help improve memory and things like that. So I'm going to leave it there. If you've got any questions, please ask us on this YouTube channel. Follow me on Facebook and Instagram. You can send messages through there too. Subscribe to the channel if you haven't done so already. Please do so. And remember, share this with all your friends, all your family, all your colleagues, associates, anybody in your circle. Please share this YouTube channel. The more people we educate, the better it is for everybody globally. So, thank you for listening. Have a great week. And just before you go, remember, say it with me, dump the soda.